All right, so turning our attention, I want to continue along these same lines with a presentation on managing survivorship. What have we learned? And I'm going to share a presentation and kind of walk you through a PHEN and Dana-Farber collaboration. Here it is. Just do a slideshow view. Okay. Hopefully everyone can see the right screen. Let me know if not. I'm sure Jerry Meredith. Okay, good. All right, so I want to thank the Dana-Farber team for inviting us to present an abstract for the poster session at the 2025 International Cancer Education Conference next month in Memphis, Tennessee. And we are so pleased to announce that our poster has been accepted. And I thought, what better way to talk about managing survivorship than to walk us through the actual poster and what we will be presenting as part of this collaboration. So I'm going to review the background, screening, and disparities at a very high level because we've addressed these topics previously throughout the summit. You can go back and view any of these episodes on phenTV.com, including this session, and we will have resources and slides available as well. And our goal within this presentation today is to showcase the successful partnership between PHEN and Dana-Farber. So in terms of background, you'll see that we tell men what we just heard. What is the prostate, right? This is where we're educating. What is the prostate? Where is it within the body? And what does it do? How do you know if you're at risk? Then it gets into screening guidelines, and it talks about NCCN, or National Comprehensive Cancer Network guidelines, which we all follow at PHEN. And talks about recommended age at 45 for men of average risk and 40 for those at higher risk, such as those having a family member or family history, or African-American men especially. Then it goes into some of the barriers to screening that you've heard here today, right? We talk about limited access to preventative care. Others face challenges with language, inconsistent health information, lack of provider recommendations, which is why we develop those tools like PHENpath. And as Johnny mentioned, discomfort with the perceived sexual nature of prostate cancer screening procedures and what that would mean for the future. And then we go into rates and disparities. And I'm not going to go too far into these, but also I'm just going to say, we see that Black men face the greatest burden. And in Boston, they're nearly twice as likely to be diagnosed and 3 times more likely to die from prostate cancer compared to white men. And this follows the trends that we're seeing around the country. When we go out and we screen, Dr. Crawford does an analysis and statistics around the country, and we do see a similar trend of men who are facing this burden. So it's not just Boston, we know it's nationwide. So I'm going to tell you a little bit about this partnership, which is so exciting to me because I've been here since the very beginning. In 2003, Dana-Farber Cancer Institute partnered with PHEN to come together to pilot a community-based cancer education initiative. The partnership combines, as you heard today, a lot of us have treatment at Dana-Farber, one of the best cancer hospitals in the world. Dana-Farber's medical expertise, coupled with PHEN's resources, our national reach, trusted community voice for culturally relevant education, outreach, and survivorship support. And in terms of programming, we offer monthly managing survivorship meetings and webinars in person and also at Dana-Farber Cancer Institute. We offer educational webinars, which are broadcast nationally on PHEN TV, and they cover topics such as treatment updates, mental health, sexual health, PSA testing, from early detection through the monitoring phase, survivorship support and resources, and clinical trial updates. These monthly meetings take place at Dana-Farber in Boston, where patients and survivors often bring their spouses, which we heard today, a lot of that for support, share dinner prior to the meeting. In addition to space and food, Dana-Farber provides medical experts, speakers, social workers, and oncologists. And PHEN members also serve as ambassadors to spread awareness and promote early screening. So they come in and it helps us teach our own ambassadors about prostate cancer so that when they're in the field, they can feel confident going out in the community and telling others about it. And I want to tell you about the evaluation and impact of this program because it's really come far since it started in 2003. Since then, there have been 242 monthly managing survivorships meetings. The group has so many benefits, not only including just getting together and learning, but also fostering strong bonds. In fact, 20 people have attended regularly in person since 2021. It's pretty rare in today's virtual world. And it's kind of established a nice brotherhood. You can see the guys there at the bottom left corner in their PHEN t-shirts. And it's just a really nice place for them to come. And from January through July 2025, we prepared this in August of 2025 this year. So between that time, PHEN hosted 7 survivorship meetings, about 1,154 people registered online, and 424 attended. The treatment options update session in July had the highest turnout. We had 204 participants. We received feedback from 300 respondents regarding these sessions, and here is what they are saying. 95% would recommend the managing survivorship sessions to others. 99% were satisfied with the content. 94% felt the pace was good. 87% felt the speakers were excellent. 95% would attend another session. 77% felt the audience Q&A was good. And I need to caveat that to say that sometimes we get so in depth with these topics that we run out of time. So there's never enough time. It's a good thing because we want people and encourage always people to ask questions. So you can see this trend line. We started out in 2021 with about 726 people. Then we moved up to 775, 2023, we're up to 862. But look at that jump in 2024. We see a 55% increase, which is incredible. But also in line with what we're hearing today, right? Men are hearing about prostate cancer later. They may be diagnosed later in life. There's all types of reasons that we could see this jump. We're also doing more in the community with our prostate cancer community rallies and church partnership program. So we're seeing growth. The message is getting out and it's working. In conclusion, we think this is a fantastic partnership and we're so proud to have it with Dana-Farber. It highlights how a hospital and a nonprofit organization team up to strengthen cancer education and awareness among let's face it, a historically marginalized group of people to improve health outcomes. And PHEN's programming empowers participants and caregivers to make informed decisions, support one another, and spread awareness within their respective communities. And the model can be replicated to improve cancer awareness, education, early detection, and screening rates. And we're seeing it now, even as technology advances, authentic human connection with experts and survivors remains one of the most powerful drivers of trust and action. So there is an option to join online, but also you can come in person. And we are really proud of this relationship that we have with Dana-Farber. I am going to open it up for any questions that anyone may have about our managing survivorship meetings or any other remarks that anyone wants to make.
Yes, Tomeeka, we have one question.
Okay.
Is the support group open to everyone, even women?
Yes, good question. The support group is open to everyone, even women, and women actually and men are invited to be part of our survivorship and caregiver. We do have caregiver sessions. If you go on PHEN TV, you'll see some of these couples. We know prostate cancer is a couples disease, and we heard it here today. So we want to make sure that we're educating caregivers, spouses, men, women, and their families about prostate cancer because it's not just a man cancer, it's a family cancer, and spouses and women are open to attend the meetings. And I will say these meetings are held the second Wednesday of each month in person at Dana-Farber. They're also online. If you want more information, we'll put the link to attend the meetings in the chat, but it's at rapcancer.org. And under managing survivorship meetings, you can see how you can be a part of these meetings. And with that, I would like to bring up our founder and president, Thomas A. Farrington, for a special awards ceremony and an introduction to one of our partners here today.